Hey everybody, I am here with Dr. Ken Starr at Starr MD Wellness Group. You can find them at kenstarrmd.com. So we're here to talk about mental health treatments and basically their experience that they've had with patients and finding relief. So Dr. Starr, thank you so much for joining us today. I appreciate it.
Thanks, Caleb. Thanks for having me.
Absolutely. And I wanted to start off just by asking how long you've been working with patients on their mental health.
Well, I did emergency medicine for 25 years, so I guess there's some mental health component in that. And then about 12 years ago, I started an addiction medicine program here on the central coast of California, where we do a lot of, obviously, substance abuse, detox treatment, and counseling. So I guess mental health specifically started around 2011 when we started our substance abuse treatment program and counseling program.
Was there, anything in particular that, drew you towards that and made you want to help patients with the addiction problems that are mental health?
Well, yeah, so I had an older brother who had always kind of, as a teenager, just went in that direction and always had substance abuse issues. We were kind of at an arm's length relationship for most of his later years. And then he overdosed and died at the age of 42 back in 2011. Mm-hmm. And then that was when I thought, well, there's just no one doing addiction medicine, substance abuse in an outpatient, affordable model, right? It was either, at least out here where we are in California, it's either the county program, which sort of caters to just Medi-Cal, indigent, government insurance type patients who most of them are court ordered, mm-hmm. or it caters to the, rehab on the beach with the view, mm-hmm. where you're going to recover with five-star luxury mm-hmm. program for $60,000 a month or something like that. So we needed to make addiction treatment just affordable and outpatient and real and get access to people. And so that was my intention. Mm-hmm. So I started that program really not knowing what I was doing. Right. Just kind of fake it till you make it. But over the years, got board certified in addiction medicine a couple times and met up with a lot of really talented people who grew the groups and the programming. So we started the program back then, and now I think we're probably one of the largest private outpatient substance abuse treatment programs in the state, actually. And then we started an infusion program in 2014, primarily using NAD. So probably some of your listeners may be familiar with that. We're probably the oldest NAD program on the West Coast, and that's real popular now. But because we had the infusion program, then we subsequently started our ketamine program about 3 years ago, maybe 3 or 4 years ago, we started a ketamine program. So we're kind of early to that game too. I think, a lot of people doing it now in our area and every other area, but we kind of just had a vision back then of what was working and bringing tools to patients that could help in their recovery.
Yeah, absolutely. Yeah. And I'm sorry to hear that was, your experience with it, but I can definitely appreciate you, choosing to take that path and want to help patients and really just make it more accessible for them to be able to, deal with those issues instead of having to, go through the routes that you talked about there.
Right. Yeah. So it's good to just try to destigmatize mm-hmm. addiction and mental health. So that's why, like, our company is the Wellness Group. The name of our company, Caleb, is the Wellness Group. And so we have a nutritionist, we do some men's health, we have substance abuse, we have a counseling program. So it's not like every person who comes in here is coming in here with addiction, right? We all have something we can work on to get healthier, to get better, and to show up, a life that we're proud of. And a lot of times it is substance abuse and dependence, and that's fine. But, like we do IV infusions, we do glutathione and vitamin bags, and we do mental health, and we have a licensed marriage family therapist. So, we all have something. And right. So it's good that it's good to destigmatize. Like the first thing people say when they walk in here is like, wow, this is nice. like what do they deserve? Like they think they're going to they should right. just lay on a concrete bunker in a bed in a bunker. Like that's what they deserve. That's right. The rehab that they envisioned. Yeah. So anyway, yeah. So that's just kind of what we do. Right. A little multi-model.
Yeah, definitely. So you're treating patients as a whole instead of just, like one single part of their lives that they might be dealing with.
Right. I mean, we certainly have over the years focused on substance abuse, and we're a licensed and accredited treatment facility. We can't just do that and not address other people's parts of their health, their nutrition, their exercise, I have a consultant who does Botox and aesthetics in the office now. Because you know what, I'm surprised a lot of people fix the inside, then they want to fix the outside, and I mean, that's not my interest. I don't do that, but you know what? It's been a very welcome part of the program and people, and it's great to see the transition. It's great to see people get control of their lives. Obviously people, once they start feeling better, the downstream consequences are just immediate, and every day they do better. They feel better.
Yeah.
They make better decisions. And so it's just super rewarding. I transitioned out of the hospital, I think, end of the year. I haven't really worked anything since last year. So I'm out of the hospital. So it's giving me more time to do this.
And what are some of the most common and biggest, mental health concerns that you feel like, patients are really trying to get relief from?
Yeah, certainly, depression, anxiety, and trauma. Depression, anxiety, trauma, PTSD, and all the interplay that goes along between those diagnoses. So, and that's the same reason that people are using drugs and chemically coping with alcohol and other substances too.
Right.
So that's really what brings people in some form or another, right? Some manifestation of that. Maybe it's an eating disorder, maybe it's a gambling disorder, maybe it's OCD, maybe it's just ruminating depression, So I'm not a psychiatrist. I don't pretend to be, but mental health prescribing is not a very big part of our practice. Although I do have a PA with a psychiatric background who does that prescribing. It's to answer your question, Caleb. It's really, I think, manifestations of depression and anxiety. Really, I think that affect most people, and that's where the magic of ketamine comes in, which is the whole future of psychedelic medication is the self-analysis and doing some of that work of recovery. Just as we do the work of recovery in a drug and treatment program, we can't say, oh, here's Suboxone, now your addiction is cured.
Right.
But we can say, here's medication to kind of get you feeling better. Now you can do the work of recovery. The same thing is true with psychedelic medications and the journey that this country's going through. I mean, ketamine is the first that's available. Right. But soon, obviously, over the next year or two, we're going to see MDMA, we're going to see psilocybin used more mainstream in it, and as a whole completely different mechanism, not just masking the symptoms of depression, like I think SSRIs do, but really helping people hold space and find out what the underlying issues are.
And, I'm curious to find out from you kind of why you feel like, so many people are feeling kind of chaos and uncertainty in their life, and, what you feel like we could really, do outside of the ketamine therapy. I think, what you guys do with having patients, try to fix more areas of their life and try to just get better overall definitely helps with that. So it seems like that's, the goal for you guys.
Yeah, our goal is just to take the whole person and try to come up with a program that they're ready for. Like I just saw a lady a few minutes ago who came into the program a few weeks ago for alcohol abuse and alcohol dependence. And, I would kind of talk. I said, okay, why don't you do this program? Why don't you try this medication? I saw her a week later. No, I haven't really done it. No, I haven't signed up. I haven't really done anything. I'm like, okay, well, why don't you try this? Let's just do this. Meet with these people, do a few groups. If you don't like it, I respect that. Let's talk. That was 12 days ago. And she's been sober for 12 days.
Wow.
She loves it. She's like, I love it. I have never felt better. I'm in this place where like I'm accepted and people understand me. And she's a common person. She lives alone. Right. She's got a couple grown kids and she doesn't have a lot of support. She comes home to an empty house, probably thumbs through social media, sees images of the world, the perfect world that it's supposed to be. Right. And feels more depressed and isolated. Then she drinks and has more shame and guilt. And so it's great to connect her with another program. Like I connected her to Lion Rock, which is a nationwide online substance abuse treatment program. That's phenomenal. It's phenomenal. It's revolutionary. And she's really just, found a lot of joy and support in that. So everyone's journey is different, and now she's doing great. And so it brings me a lot of joy, and she feels good and I feel good. So that's that kind of one example. That's an alcohol patient, but we've had, we have a ketamine program, and we've had people just get tremendous response with ketamine. I mean, just life-changing changes in their depression, in their mood, in their anxiety. That's really, career-changing, life-changing stuff that they've never made breakthroughs. Yeah. They've been on medications for 30 years, 20 to 30 years. Antidepressants had never had just tremendous breakthroughs like you get with, or that are possible with some like psychedelic medications like ketamine. So I don't know. I like Santana says, the music's out there, man. I'm just the antenna. I don't know what people need, but it's good just to do an assessment and give them some different options and give them a different direction. And obviously some people are more ready for different things.
Right.
So it's great. It's great to work in an environment where we have different things. Where we have this, we have some testing, we've got some nutritional, we've got some ketamine, we've got meds, we can substance abuse, we have therapists. So it's a great gig.
Yeah, I can imagine being able to, help patients and really help them find relief has to be really rewarding for you guys. Yeah.
It is rewarding. There's some downsides too. I mean, obviously substance abuse treatments feel challenging. And with the potency of street drugs just getting stronger and stronger. And we've lost more patients in the last 2 years than I've lost in the last 10. I think I had 1 or 2 overdoses my first 8 years of practice. And now we probably lose a patient every couple of months. Because it's not the days of you being like a heroin user your whole life. There's guys we've had guys who've used heroin every day for 20, 30, 40 years. Those days are over.
Yeah.
Now, those people they're either in recovery or they're overdosed. There's no one now just using fentanyl who has a normal fentanyl habit that's not going to overdose and die. It's just too sketchy now. And that wasn't the case years ago. So there's challenges in that space too.
Right.
It's mental health is definitely a challenging and rewarding field.
Yeah, absolutely. And, for mental health, on average, how many treatments do you typically recommend for patients to get? And, what are kind of the maintenance and follow-up treatments for them?
Specifically for ketamine?
Yeah.
Or, ketamine is really interesting. It's more than one. I'll tell you that. I mean, certainly one treatment. So we use just the National Institute of Mental Health protocol, nothing special or fancy or unique or creative about it. We started about 0.5 milligram per kilogram, and we go up every infusion about 0.15 milligrams per kilogram. So basically all that means is like your first ketamine infusion is very low dose. It's kind of an introduction to this space, like how this is going to feel. No remarkable breakthroughs, usually not a lot of change. And then we'll do 6 treatments over say 2 or 3 weeks with an escalating dose for a couple of reasons. You get more comfortable with it. You develop a little tolerance to it. You can get deeper into that space. So, so we use 6 treatments as our program. Some use 8. I don't think everybody needs 6, but that's kind of our program. So we kind of space it like that, just available, just because of previous research showed that was really the most helpful. But it's really the last 3 treatments where you see the benefit, right? It's like only something like 10%, 20% respond those first 3 treatments.
Yeah.
And then closer to 70% respond by the time we get to 5 and 6. So that's how our program is set up. And obviously there's a lot of variability. Sometimes we'll have to do IM. We can't get an IV. We have an intranasal protocol. We have an intramuscular IM protocol. So that's our experience. And sometimes and some people are more comfortable with the medicine than others because of just whatever reason. And so we'll use even higher doses for some people. So anyway, so we kind of have a guideline on our program, but obviously depending on people's response and comfort level. And we've had patients we don't go up. They actually did worse with a higher dose, and they did better with a lower dose. So then we back it back down. So it's just kind of touching base with people and finding out how they felt and what they were comfortable with.
And when would you typically think that someone should try to seek professional treatment with that? Obviously, we want to have patients come in and get treatment before having to do, a ton of antidepressants or, try to find relief with other, street drugs, like you said. When would you, typically say is the best time to go get help?
We like personally, I like my patients to have had some traditional treatment. I know a lot of psychedelic and ketamine physicians would disagree with me, but I don't think ketamine is really a first line. And in fact, the indications are, treatment-resistant depression or treatment-resistant anxiety. So meaning you've done some counseling, you've done some therapy. Ideally, maybe you've done some medications or not, but you've had like a formal diagnosis, you've had some treatment, and then we'll see those patients. So in our program, I don't really require a referral from a provider as much as I want them to have a mental health provider in their life now. because so much comes up, right? They come here, they can do ketamine,
Right.
but they need to do that, integration. And also a lot of people have, a lot of stuff come up during the treatment. So we don't always, depending on the patient, we don't always provide that therapist. Some people have their own providers. So it's just important to me that people have some sort of mental health provider. It doesn't have to be a psychiatrist, it doesn't have to be a therapist. Maybe it's a life coach, maybe it's a social worker, maybe it's, someone less formal. That's fine, as long as they have somebody who they can kind of, debrief with, because those periods are very powerful. A lot of stuff comes up. You have to talk it out.
Yeah, definitely. And do you
I don't know if I answered your question. Sorry, I don't know if I answered. So I think you answered when. I mean, ketamine is now like a first line treatment for patients who are suicidal, even by like the American Psychiatric Society and more conservative organizations.
Right.
So I don't want to wait till people are suicidal before they come in, but just to know that there are some treatments out there that work differently and that may be really beneficial.
And lastly, do you have any kind of advice for patients that maybe they've tried kind of different antidepressants, they've tried the traditional routes and really just aren't finding relief? What do you recommend as kind of their first best step in getting a treatment like this?
Well, it's important to know that only about 30% of people have any good response to antidepressants. So not responding and not getting a lot of relief from antidepressants is actually the norm, right? 70% of people don't get any better with oral antidepressants. So I don't want people to feel like, oh, there's something wrong with them, this medicine's supposed to work.
Right.
A lot of people also are on, antidepressants for years and years and years, and they don't even know if they're working or not. They just know they take them.
Right.
And if they stop taking them, they don't feel well. So there's that whole thing.
Mm-hmm.
I forgot the question.
Yeah, just
what was the question?
Yeah, kind of what the best first step is in that process of, trying to find an alternate route like what you guys offer.
Well, there's a lot of, I think really just the overall frame is that, psychedelic medications are an expanding and growing part of the mental health treatment universe that are going to become more and more common. And, say a treatment like ketamine, if somebody has severe depression and anxiety, I would encourage them to do ketamine. And it's pretty accessible. There's lots of treatment programs in all sorts of towns and cities. And it's not like when I first started with that, I thought, this is like a psychedelic medicine. You're going to see purple monsters chasing you. And, I've done ketamine now, and it's not like that at all. It's just a deep relaxation of self-awareness. The disassociation really helps you change your mind. It can really help you question why you think what you think or why you believe what you believe in ways that just SSRIs or medications don't.
Right.
So it's a really safe and effective avenue of getting to a place of awareness that it's hard to get to in a state that's not assisted with that type of therapy.
And what would be the best ways for patients to get in contact with you guys?
Sure. Well, our program, we're on the central coast of California. So we're in San Luis Obispo County. So our patients, we have patients come from all over the country for our detox programs, but usually the ketamine programs, because they're a little bit longer, it's local people in northern Santa Barbara County, southern Monterey County. Our website is kenstarrmd.com. So there's some information there. Our YouTube channel, I would love if everyone subscribed to our YouTube channel. We're certainly trying to build that audience to help provide education on substance abuse and mental health treatments. And so I would love if everyone can check out and subscribe to Ken Starr MD Wellness Group on YouTube. And then the phone number is 805-242-1360. So we can, we do some medication prescribing out of state, in different states where I'm licensed. But yeah, mostly it's just giving people some knowledge and some education and helping them kind of make their own path more clear and accessible.
Okay, perfect. Yeah, well, those are the questions I had for you. So I really appreciate you taking the time to talk with us and share the education. Great.
Yeah, thank you. Thanks for having me.
Yeah, of course. All right. Well, have a great rest of your day, Dr. Starr. I appreciate it.
Okay. Thanks, Caleb.
Thanks.